So, hello guys, welcome back to Life and Mocktails. Today we have Dr. Anand from Dr. Anand Pediatrics, and I'll ask him to introduce himself rather than me introducing him. So,
So, thank you, Dr. Shashwat. That's very, very kind of you. First of all, I would like to thank Dr. Shashwat that he allowed me on his beautiful platform just to share something about pediatrics. For all the newcomers, my name is Dr. Anand Bhatia. I am MD Pediatrics. I did my MBBS from Rajiv Gandhi University, Bangalore, Karnataka. I did my MD in the field of pediatrics. Then I did my SRship from Lady Harding, and that's it about me. And I am a very small person who teaches okay pediatrics. So
no, that is he being very modest right now. He's actually really good. You should watch his videos, and they're really fun and motivating as well. He keeps giving motivation within the videos. So, yeah,
that's
and
very
today
kind.
we are together to help all the FMG aspirants and, in a way, all the students who are part of reading pediatrics.
Oh,
So, we have some question and answer to how to approach pediatrics. So, without wasting time, we should get straight away to the question. So, my first
yes.
question is, how easy or difficult is pediatrics compared to other subjects when it comes to preparing for any exam?
So, okay. So, as far as pediatrics is concerned, the good part about pediatrics is that it is one of the lighter subject. For
Mhm.
pediatrics, it's like we're talking about the child and newborns. So, the topics of pediatrics are much lighter as compared to medicine, surgery, obs, gynae. They are very elaborative and very lengthy subjects. Pediatrics is to the points. The questions are very repetitive and they're to the points, and it's a very high scoring subjects. Just because it is a
Mhm.
to the point subject, it's automatically becomes a very high scoring. So that is as compared to other subjects, these are the good points I can tell you about pediatrics.
Mhm. And generally, how much time is required to cover pediatrics from exam point of view?
From exam point of view, it actually depends. As you all know, pediatrics is a final year MBBS subject. So when we take classes or we try to teach, like we try to sum up the whole pediatrics, but one has to address this point also, that this is a final year, 1 year full subject. So somewhere the
Mhm.
subject plays a very important role, and at the same
Right.
time we all know the next is coming, or some new exams here and there keep coming, and clinical subjects are given very much orientation these days. You need to have a very close observation to our juniors also. I keep telling them, attend the postings, watch the cases, because they are asking a lot of clinical questions coming to pediatrics, and peds is almost touching medicine in almost every aspect. So in that case,
Mhm.
I will not say any specific time limit to cover the pediatrics, but I would rather say that if your exam is like 6 months or 5 to 6 months away from the downline, you start preparing, and slowly you give at least 1 to 2 hours per day to your pediatric subject. That's all I can say. Then it all depends from person to person and
Mhm.
something like that.
And is it actually important to cover pediatrics before exam? And because if I Google pediatrics percentage for FMG, it comes to around 7 to 10% questions are coming. So is it actually important to cover it at all?
Yeah, so that's a very wonderful question you had asked actually. So this is a very important point I would like to address over here. That's it's a little myth that that it's only 7 to 10% we cover the in pediatrics, or questions are being asked. But frankly speaking, if I tell, pediatrics is almost like medicine, like nephrotic
Mhm.
syndrome, asthma, pneumonias, congenital hearts, tetralogy of Fallot, asthma, pneumonia. Everything is there in medicine. Also, it is there in pediatrics also. If I talk about breastfeeding, breastfeeding is a gynae topic also, again pediatrics also. If I talk about vaccination, immunization, most important, Mission Indradhanush, and all the latest questions on World Malaria Day, Rabies Day, it is again a community medicine question also, pediatrics question also. So that's, now it's
Mhm.
a thin line. Recently the question had come on inborn errors of metabolism. There were 7 questions on IEM, even in FMG and also in the other NIMHANS and AIMS paper. So
Mhm.
IEM, inborn error of metabolism, again that's in pediatrics also, and that's in biochemistry also. So that way, if I tell you frankly, there is no limit where you can say कि नहीं नहीं, this is only pediatrics, वो तो medicine में आता है, because we also teach inborn errors of metabolism. So that
Mhm.
way, I would like to clear this point of every student, that there is no this thing कि अरे यार, this is a minor subject, let's not do it. अरे 8-10 ही question आते हैं, and we don't get so many questions like that. Someone who has genuinely read the topic and the subject, he will definitely realize that it is almost like any other subject, and it's actually luckily connecting a lot of other subjects also. So
Right.
a wise opinion will be that not to skip this subject, because frankly, as a friend, if I tell you, you will definitely gonna clear a lot of questions if you finish pediatrics.
With the knowledge of pediatrics, if not direct questions from pediatrics, but with the knowledge of pediatrics, we would get more than the pediatrics questions.
Very true, because there is no, it's very thin line, you know. Inborn errors is there, and there also, here also. Breastfeeding, so there are 58 MCQs on breastfeeding. If you open the chapter and recent last 3 year question papers, there are 58 MCQs only on breastfeeding. So you can't,
Hmm.
when breastfeeding is in pediatrics, newborn baby will breastfeed. It's a gynae topic also. So you can't
Yeah.
bifurcate. Nahi, this is in gynae, this is not pediatrics, you know. So that's what.
Right, right. And is there any like pro con differentiation, like pro cons of studying pediatrics, pros and cons?
Yeah, pros and cons. So obviously, the benefits will be more than the bad thing. You know, the bad thing, if I tell, like what I have taken, seen, we have taken the survey. My juniors, they say that, sir, milestone is little tough and all that. Neonatology, newborn, lot of tongue twisting questions, because for a pediatrician, milestones is like bread and butter for a pediatrician, and always we have a question on milestones. When can a baby make a square? When can a baby make a triangle? Like that. So that becomes like very suffocating for any graduate, because you have to remember a lot of numbers and all that. But again, at the same time, you know, we all know no pain no gain, you know, no pain no gain.
Right.
How does the diamond form? By, you know, scratching, 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 and scratching. So that's how thing is, you know. That's what.
And yeah, that is a like really helpful advice from you.
Thank
And
you.
coming to the next question, it is strategy to solve more and more questions before the exam. Like,
Yeah.
how would
So
one approach to solve the questions?
one very wise approach we must have, read a topic and do the MCQs. Like,
Mm-hmm.
if I talk about the, if I talk about the most important topics in pediatrics, number one, indirectly you must do the last 3 year question papers. They are indirectly finishing the important topics in pediatrics. Whatever the topics of pediatrics were there in 2002, in 2023-24, they are the same topics of pediatrics. कुछ बदला ही नहीं है. क्या बदला है? लोगों का नजरिया बदल गया. ये भी ऐप आ गई, वो भी ऐप आ गई, अरे यार वहां से भी पढ़ लो, वहां से भी पढ़ लो. I have notes also, okay, I'll give you and all that, you know. I have that faculty notes. I hope you all know that, because we have so
Yeah,
many.
yeah,
Once you get a lot of platforms, online and offline, you get so confused and you like, नहीं नहीं वो ज्यादा अच्छा पढ़ा रहा है, वो ज्यादा अच्छा पढ़ा रहा है. तो नजरिया सिर्फ हमारा बदला है, सिलेबस तो वही का वही है, टॉपिक तो वही के वही हैं. तो
yeah.
दैट्स द होल थिंग, आई वुड से, यू नो, लाइक, you need to have a very smart approach. It's
Mm-hmm.
not about the hard work. Frankly, today the word, it's not about the hard work, it's about the smart work. Smart work plays a very important role. Nowadays they're asking a
Right.
lot of USMLE and MRCP-CH questions, like, if you are the doctor on duty, you found a baby with hypoglycemia, what will you do? It's like as clear question as that. It's not like rata
Mm-hmm.
hua question, you know, that what is a gene mutation. So that's the,
Mm-hmm.
a smart approach, I guess, is something we must think of.
Mm-hmm. And any advice for like specifically if you're preparing for FMG, any special advice for them to prepare like strategy and how to revise?
Yeah, so one important a wise advice I can give you, that your last 3 to 4 year question papers are everything. This year
Mm-hmm.
question paper, if we have seen, it's more tough than the NEET PG question paper. Lot of tricky questions, lot of image based questions, even scenario based questions they are doing. So that's why I would want to say here, whenever you're reading a topic, make sure you finish MCQ at the same time, number one. Number two, one very important thing which I was telling to my other all India rank 4 one girl, she was there, I was telling her also that, this, if you're studying something on Monday, when Tuesday you're studying, Tuesday night, make sure for 1 hour you must revise what you studied on Monday.
Monday.
Then on Wednesday night for 1 hour, you must revise what you studied on Tuesday. On
Mm-hmm.
Thursday night, again, you should revise what you studied on Wednesday for 1 hour, like in 1 hour, like a small gist.
Mm-hmm.
One very bad thing which we all do, नहीं सर एक पूरा syllabus खत्म हो जाए बोल के तो मैं फिर revise करूंगा. Let me finish
Right.
all the 18, 19 subjects, then second revision I start. And once you finish 18, 19 and then you start the second revision, you end up forgetting everything. and that's how the
Mm-hmm.
morale goes down. Yaad nahi aa raha, it's so difficult. Oh my god, my head is getting banged up. It's so, how will I remember? So once you revise every day for 1 hour what you studied one day back, your retention memory, which goes down again comes up, goes down again
Mm-hmm.
comes up. Are you understanding? So 60 days down the line, 120 days down the line, you would have automatically revised something so many times that there is no drama you saying that let me finish everything, then I will do the grand test, and then I will do the revision. Then you will suicide only. Nothing else you'll do.
Right. And because you referred image-based questions as well, like how should one approach and what are your ideas on how to prepare for image-based questions?
So that's what a lot of our dear juniors who are there in my medical college final years and all, whenever we have a MBBS spotter class, they take a photos for instruments, for drug vivas, for vaccines, for X-rays. So vaccines, drugs, X-rays, and instruments, ये तो आना ही आना है. मतलब it's a final year MBBS topic also, and it's a automatically NEET PG and an FMG question paper also. So whenever
Mm-hmm.
you see in your classes also, whenever you see, you should, you everyone, I request, even though you are out of India or in India, go to your ward, respective wards, make friends with the faculty and teachers, or JR, SR, or intern, whosoever is there in your medical college. Talk to them. See, once you make a rapport with those people, even though the language is different or whatever it is, but still somewhere there should be a room for learning. And just in your 10 to 1 clinical postings, you can't learn everything, because half time, there are a lot of other associated things also. Sometimes you are absent, sometimes teacher does not want to teach, sometimes the batch is so big that we are not able to understand, language barrier. There are multiple things, but don't stop learning. Don't stop going to the wards, because once you see there, take the photo. In my hospital, लोग तो भर भर के आते हैं हम मुझसे पढ़ने के लिए. Like my batches are always totally jam packed full, because I try my best to show them how do you do a Kornic sign, what do you look in a newborn. Okay, tell me what is this milestone, and they take a photo jaldi se. Pleural effusion X-ray, take the photo, sir. ये क्या है? Because pleural effusion will be a NEET PG and FMG X-ray question. It's a final year MBBS question also. So smart
Right.
approach, image-based approach. Wherever you get the images, collect the images. I have taken recent interviews of very good students who have told they have a very beautiful 200, 300 images of pediatrics, and slowly by friends, by this and that, they collected, and उन्होंने बहुत revise किया वो. So it was very helpful for them.
And if someone has like already completed his studies and now he is preparing, like taking coaching classes and all, so from there, how would someone like someone does not have the opportunity to go to the hospital and take pictures? So for them, how would they prepare for the image-based questions?
So it all depends. If you're talking about the offline class, which we take in Delhi and all over the India, so I take 3 days of rapid revision of pediatrics, which we take, but it's from 9 to 9 for 3 days. So 9 a.m. to
Mm-hmm.
9 p.m. Monday, Tuesday, Wednesday, where Monday will cover the general pediatrics, Tuesday systemic pediatrics, and third day we have the rapid revision image based from 9 a.m. to 9 p.m. 600 images of pediatrics, only 12 hours image like that. That is the offline thing. But luckily or unluckily, I'm not in India, I'm there in abroad. I only have some random video package or anything like that. One thing I can tell you is, like, follow one educator. It's not like study
Mm-hmm.
from only from me, only from him, or only from her. Who's like, one very important advice I want to give you: every teacher is good. Anatomy, physio, biochem, हर टीचर कहीं ना कहीं पढ़ाने की शिद्दत रखता है और अच्छा पढ़ाता है. पहले तो विश्वास रखो. Once we go to gym, we need to have trust in the instructor. If you don't trust your instructor, you will never make a good body. No, I
Right.
know how to make a body and all that, but if you have to trust your instructor, then only the good vibes will come. So whosoever application platform you have taken, follow that very religiously. And in that segment also, the fellow would have told how to use this app, how to use, like, if I have pediatrics for 50 hours, I have made a video how will those 50 hours should be divided in a day, how in a 15 days or a 20-day task, if you watch my videos 2 hours per day, so 12 days 24 hours, and 24 days 50 hours, you will cover like that, and then you have a grand test. And so it all depends. That's what I'm trying to say. So
Right. Right.
whatsoever app you have, follow one educator religiously, he is your god and that's it. नहीं नहीं, वो इमेजेस वाला वो सर अच्छा पढ़ाते हैं, नहीं यूट्यूब पे भी फ्री सेशन है वो भी अटेंड कर लो, अरे मेरे फ्रेंड के पास नोट्स भी हैं तुम वो क्यों नहीं ले लेते करके, बस फिर बंदा पागल ही हो जाता है, फिर कुछ नहीं होता, एंड दैट्स द रियल स्टोरी यू नो। आई ऑल्सो इन माई एमबीबीएस आई हैड फाइव एक्स्ट्रा पीडीएफ, गौतम नगर से 100 रुपए का पीडीएफ मिलता है करके, एंड आई हैड सो मेनी बुक्स एंड ऑल, बट सब पढ़ाते एक ही हैं, सो देयर वी हैव टू हैव अ थिंग, देयर समथिंग नोन एज फोमो। फोमो इज फियर ऑफ मिसिंग आउट, मेरा
Missing
छूट
out,
जाएगा,
right?
मेरा छूट जाएगा करके, बिकॉज गर्ल्स बॉयज वर टॉपर्स, कि वो भी पढ़ रहा है, वो ज्यादा पढ़ रहा है, मेरा छूट जाएगा, सो वो प्लीज ना रखें, सबने सेम ही पढ़ाना है, एक को फॉलो करो, आराम से करो।
Hmm. Thank you. And we're like almost end of the question. We are just left with one question. That is, how is pediatrics as a career option?
Yeah. Okay. So pediatrics as a career option is a very wonderful branch. There are only two things which is connected. Number one, you should follow your passion. It must be your passion. Otherwise, it is the most irritating branch on this planet. Why? Because the child is always crying. Newborn baby,
Right.
newborn baby will not tell you मेरे को इधर या नीचे दर्द हो रहा है बोल के. He will not tell you that. He'll only cry, 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 and mother, for every mother, her child is sick. फॉर एवरी मदर, बच्चा कुछ नहीं खाता, डॉक्टर कुछ नहीं खाता, मोटा तगड़ा बच्चा होगा हाथी जैसा, कुछ नहीं खाता डॉक्टर, मैं तो परेशान हो जाती हूँ, कुछ नहीं खाता, फॉर एवरी मदर हर चाइल्ड डजंट ईट एट ऑल, ही इज द वीकेस्ट ऑन दिस planet. So there again, that's a thin line, you have to bifurcate what to listen, what not to listen. And so that's
Right.
number one, follow your passion. I have seen students looking at me, nahi nahi, PS Anand sir looks very happy, PS is a very chilled out branch and all, and I have seen them taking MD, then cutting the government their, they have a what you called bond, paying 5 lakh rupees and coming out of MD pediatrics. It's like they that much suffocated they were like, sir, I'm not able to take it, pata nahi mujhe to laga bahut acha hoga, but it's very chaos and all that. So that's so number one, follow your passion. Money is everywhere. Post MBBS also, can someone can earn 3 to 4 lakhs per month, and I have a separate strategy for that. Someday if you want, I'll give you. But it's
Yeah,
that's
sure,
what
sure.
you need. Yeah, you need to follow your passion, that's the thing. And luckily, okay, fine, yeah, I like babies, yeah, it looks okay. So if you like babies and all, then that's fine. Pediatrics is a very wonderful branch, it has huge making money. Neonatology division is a very beautiful segment in that. NICU has a lot of ventilators and all, and if you're in a NICU, neonatal intensive care, someone touching a ICU, so it's like you get huge amount of money. If any newborn is admitted in a private hospital, any private, so one day ka 1 lakh ka bill to aata hi aata hai, no matter what, because the device is very expensive, medicines are very expensive, the ventilator charges itself is very expensive. So that
Right.
way, if you're the doctor on duty or the consultant or the junior or luckily senior consultant, then naturally you earn a very good amount of money. So money is there, it's a wonderful branch, but number one, you need to have a passion in that, and number two, you should not be short tempered. ये short tempered लोगों के लिए बिल्कुल भी नहीं है pediatrics branch. बच्चा आपके हाथ पे पॉटी करता है, मेरे तो हाथों में बच्चों ने पॉटी कर रखी है, बच्चे को गोद में लो कि भी क्या प्रॉब्लम है, वो सिर्फ हाथ में पॉटी कर दी। अब कोई गुस्से वाला होगा, वो तो पता नहीं क्या क्या सुना देगा बच्चे को और पेरेंट्स को। सो यू नीड टू हैव वेरी काम माइंड, बच्चे चिल्ला रहे हैं, चिल्ला रहे हैं, चिल्ला रहे हैं, कान खराब भी कर दें, तब भी आप बहुत प्यार से सुने, हंसें, बहुत अच्छा बेबी, वेरी क्यूट बेबी, ऐसे होना चाहिए। हमारे राउंड्स भी होते हैं ना डूड, लाइक ऑल स्मॉल 6 मंथ्स ओल्ड, 8 मंथ्स ओल्ड, हम बेड नंबर 2 और 3 तक पहुंच नहीं पाते, बेड नंबर वो 1 इतना क्राई करता है, बेड नंबर 5 पे जाते हैं तो बेड नंबर 1 2 3 4 क्राई कर रहे होते हैं, एंड इन गवर्नमेंट हॉस्पिटल देयर इज नो
Oh.
सेपरेट कैबिन्स एंड ऑल दैट, इट्स लाइक फुल वन बिग हॉल एंड लाइन से बेड होते हैं करके। सो व्हेन यू गो टू बेड नंबर 18, तब तो इतना शोर हो चुका होता है, फिर तो मतलब भगवान से प्रार्थना करनी होती है कि भाई you should not get angry, no, it's very happy branch here. It is so tough that way, but if you love the branch, if you have patience, if you use your brains, I don't have to get angry in that, patient तो आने ही है, वो तो देखना ही है, you can take a break in between, you can chit chat, slowly see the patient, time तो लगना ही है, तो that way I think that's what is the whole story.
Well, 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 thank you. And yeah, we are like almost done with the questions, and it was really nice. Like all your answers, it is gonna really help me personally and everyone who is watching this for their exam. It is surely gonna help them as well. Thank you so much for your time. Like, I know you are busy with your work and children's crying, and we're teaching as well, and you're doing this continuous session on pediatrics for question and answer. I'll link down your Instagram as well. because this is really going to help, because there are questions and you get answers about that. You practice your questions while scrolling Instagram. So it's a good idea.
Yeah.
So yeah, thank you so much.
So much. And one thing I would like to, first of all, many, many thank you to you, Dr. Shashwat, for giving me this opportunity to come to your platform and say a few words. That's very, very kind of you. And one advice I want to give to all the students, all the millions of people who are gonna watch this show in future. One advice I want to give you is that there is no shortcut to success. There is no shortcut to success. We all have taken the stairs. This is one thing we all need to understand over here. देर इज नो शॉर्टकट 3 दिन का क्लास अटेंड कर लो पास हो जाएंगे या ये नोट्स ले लो पास हो जाएंगे इट वॉज नेवर अबाउट पासिंग इट वॉज अबाउट अंडरस्टैंडिंग द कंसेप्ट that is very very
Right,
important because someday you're gonna we are dealing with real life here. It could be it can be my kid, your kid, any of your cousin's kid. So if you have a ratifying or a cramming knowledge, that won't be helping the baby. So somewhere in future it all gonna connect somewhere, your knowledge and everything. So number one, there is no shortcut to success. We all have taken the stairs. So whatever you study, I recommend everyone have a understanding concept behind it कि बच्चा अगर जॉन्डिस से आता है तो तुम क्या करोगे टाइप्स सो एक ये होना चाहिए एंड सेकेंडली मोस्ट इंपॉर्टेंट लाइक वट एवर यू गाइज नो शेयर विद योर फ्रेंड्स we nowadays I've seen people there we all have become little selfish नहीं नहीं मेरा रैंक उसका रैंक आ जाएगा उसको तो ज्यादा आता है I have people coming to me मेरे को पढ़ाओ I am your good student why are you teaching her teach me no I will read and come whatever you say so so that is I have seen people so whatever how much ever wherever you are learning share to your friends teach to your friends because in the end we need to have a long term vision a wide vision we need to uplift the mankind we need to uplift
right,
everyone somewhere by the end of the road we all are doctors we all are one family and we have to motivate and uplift everyone it's not just me and me it's you and me and him and her it's all of us somewhere you also
right,
Shashwat will take a gynae or a ophtha or anything surgeon you will become a super speciality person but you need to have a backup thing in mind कि मैं जो भी पढ़ूंगा किसी को पढ़ा दूंगा या नॉलेज को शेयर कर दूंगा समझ रहे हो बिकॉज ये आगे आने वाले टाइम में बहुत जरूरी है एंड समवेयर you are the future doctor somewhere when I go 90 years you will be around 20 years less than me so you'll be treating me that time so somewhere if you do good the good will come so this is a small message to all the students I'm sorry I hope I have not bored you from this
no, 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 not at all. This is like really motivating. Like the last part you said, when you will be 90, I'll be 70, and I'll be treating you. It is like it felt right here. Like wow, I never saw it that way, but
Yeah, and somewhere
wow.
that's very true because even frankly, I tell today also morning in our rounds, we had a patient on ventilator. My DNB, my MD, we are discussing and all. So we have a team. We have a set of 5 to 7 doctors. One is a senior, then junior to me DNB, the final year, first year. Then we have the JR. Then we have the intern who is just finished his MBBS. The intern was standing very far. He was little scared. कि भाई मैं ये तो बड़ी हाई फाई बातें कर रहे हैं मैं क्या ही करूँगा करके. Then I called him there. I was like, why are you standing there? You should be here. नहीं नहीं sir, I was not knowing and all. नहीं, you should be here. You should listen, no? You should listen कान खोल के कि क्या बात हो रही है. Because they are the future doctors. They are literally the future doctors. We all are one, but somewhere he should get acclimatized to what we are speaking, so that 20 years down the line, 40 years down the line, he will be the one who will be treating us or something like that, or even your mates. So that thought process should be there like that. You need to and you need to address all those things. Sometimes we get selfish. हाँ पेशेंट देख लिया बात खत्म चलो चलो हो गया बहुत काम है बहुत काम है बहुत काम है but you need to see okay intern should be addressed you should respect your juniors so that's very important so
Right,
that's
right, right.
thank you so
Thank you
much
so much. This is like a really good session. Like 23 minutes and a lot of thing to learn. Like
and it's
super good.
midnight 1 o'clock, in the night you and me are sitting and recording this that's another crazy
Yeah, I hope this helped everyone. And if this helped everyone, please like and comment for both of us. And I'll definitely link down his YouTube channel as well in the description.
yeah
So
yeah
you guys can
that's
go there and subscribe and watch his videos as well.
That's
So
very kind of you, and that's very sweet. And in future, also, whenever you need me, or whenever we can have a common discussion or a common talk about anything pertaining to pediatrics or outside pediatrics, also, so we'll keep doing that so that people, everyone should be helped nicely.
yeah,
Okay,
yeah, thank you so much.
so much. Have a
So
have a great day ahead. Yes, thank
yeah,
you.
yeah. So I'll end this video right now. Thank you, guys.
Thank you.